being here with you on Wednesday evening at 8 p.m. And just remember, it's interactive. You could lay back, relax, and listen to the program, or you could give us a call. You could tell us what's really on your mind, respond to the topic of the day, and make your contribution. Ask some questions. Of course, we start off with a little bit of a monologue. And this evening, I want to talk to you in this continued series about sugar diabetes, but to look at a different aspect. And I want to introduce a word to you called PAD. PAD, P-A-D. You wonder what the hell is he talking about? PAD. Well, it's called peripheral artery disease. Peripheral artery disease. And it's big. And I'm talking a lot more about diabetes because it's easy to talk about a disease that 3 or 4 Vincentians have. But diabetes, we're talking about thousands of us Vincentians have diabetes. And those who aren't diabetic, full-blown, they're pre-diabetic. And those who are pre-diabetic have insulin resistance. We're talking about 25% high, big in the Caribbean. And it's important that you understand about it. And too many people, the years are going by and they don't really understand. Now, I want to tell you, your heart is in your chest. And your heart pumps blood through several big tubes. The tubes, blood vessels as we call them, that are carrying blood up into your head, towards your brain, your eyes, all the organs in your head, especially your brain, are called the carotid. There's one on the left, one on the right, the inside. And these blood, you could feel it. You could feel the pulse. Just like, you could feel the pulse, blood being pumped up into your head. Man, your brain needs that blood, needs the nutrients, the oxygen. Then, before blood is pumped up into the head, guess what? The organ that's doing the pumping, your heart, is a muscle that needs blood too. That needs blood too. And there are some tiny blood vessels. These blood vessels are about as big as this. And these blood vessels leave the, just after leaving the heart, those blood vessels curl back around to supply blood to the heart muscle itself. Those are called the coronary arteries. So let me see. Blood vessels that leave the heart, carrying blood to different parts of the body, are called arteries. And when they've reached those destinations, that blood doesn't just disappear. That blood eventually collects back and carries back that blood in new type of blood vessels called veins down back to your heart. Now, there are blood vessels which are arteries, carry blood all the way down to your legs. All the way down to your legs and your toes, your heel, all that kind of thing. Those arteries are important too. And then guess what? After they've delivered blood, oxygen and nutrients in the blood down to your feet, nourishing all those muscles, your calf muscle, your thigh muscle, the bones of your toes, your left toe, your right toe, this, that big toe, all that kind of thing. It's going to bring blood back through your body, back up to the heart again. Right? Or in between there, we have our lungs that as we breathe, We are bringing oxygen into our body, into our lungs, and the body finds a way of enriching the blood that comes back towards the heart in veins to give it now a new boost of oxygen. And that's the way the body works. That's the way how things run. That's the way how things run. Now, today I am talking about peripheral vascular disease. That is the way the heart supplies these nutrients, oxygen, blood, to other parts of your body except for the heart, lungs, and the brain. And guess what? Blood going down into your hands, we consider it peripheral, right or left. And blood going down into your legs is also considered to be peripheral. Well, and this is what I want to talk about today. You don't find much problems with your hands. It's your legs. A lot of people have what we call a peripheral artery disease, which predominantly affects their legs. And I'll tell you a little bit about the symptom, but I want to start off by saying diabetes is one of the biggest causes of this peripheral artery disease, PAD. And, you know, the damaging effect of the sugary, syrupy blood, of sugar inside the blood, damages not only the inner lining of the blood vessels, but also the nerves that supply the blood vessels. Diabetes accelerates the deposit of some what we call fibrofatty tissue, right? Made up of cholesterol and those sort of things. It forms plaques inside your blood vessels, right? And that causes narrowing of your blood vessels, causes them to become thinner. That means that blood cannot flow through them as fast and in the amount that it's supposed to go. And then diabetes. I understand diabetes is a big inhibitor of healing. Every day in your body, there is the need for some repairs. You know, whether you have a car, a van, whether you have a shoe, whether you have some item, these things always undergo some damage and need repair. I want you to understand that your body also undergoes daily little bits of damage. And diabetes prevents the natural healing and repair that takes place. And I'm going to get into that. And a combination of these things all lead to peripheral vascular disease. Now, do you understand? There's a term I want to mention to you because you're going to see it from time to time. It's called atherosclerosis. 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 You know, I didn't want to mention it, these big words and so forth. But you know what it means? Atherosclerosis. Athero means artery. Sclerosis means scarring. So artery scarring. And we ain't talking about the outside. We talk about the inside. And I'll repeat again that when you start to have this fibrous, fatty, cholesterol stuff being deposited on the inside of your blood vessels. The inside of blood vessels may have a certain space for blood to flow through. But if these plaques start to get inside of the blood vessels and be deposited inside the lining, I want you to understand it's going to narrow the way blood will flow through. And we call this atherosclerosis. Now, high blood sugar in diabetes contributes to the formation of these fatty cholesterol plaques inside your blood vessels. Diabetes is notorious. In fact, diabetes tends to do this more in the very tiny blood vessels. Now, I'm repeating myself a lot because it's so important. These plaques, right, narrow the arteries, restricting blood flow to your limbs. And this is one of the primary reasons for peripheral artery disease, what I was abbreviating as PAD, P-A-D. And the progression of this atherosclerosis, more and more plaques, more and more plaques. Guess what? Some blood vessels actually get totally blocked off. I talk about 60% block, 80% block. I mean, totally blocked off. Blood can't flow through. That's not nice, you know? Now, you heard me in the intro talk about, do you know that diabetes affects your natural healing and repairs? Well, diabetes can disrupt your body's natural ability to repair damaged organs, damaged blood vessels, and so on. Now, in healthy individuals, minor injuries trigger a whole healing response. We have a healing response, Kamal, you know? Our body heals. Of course, when you're 10 years old and you're 15 and 20 years old, your body's healing nicely, healing wonderfully. But when you're 60-something, 70-something, let me tell you, your body ain't healing as well as it used to, like when you were 19. And if you have diabetes, guess what? It's far worse. Your body basically is inhibited from healing properly, right? Not only that, I was telling you about nerve damage, you know? And the nerves that tell our blood vessels to expand and contract, expand and contract, allow more blood to flow through, allow less blood to go through. Those nerves start to get damaged, right? And diabetes is notorious for causing that kind of damage. And then there's a condition called inflammation. Boy, inflammation. Inflammation is the big thing today. We never thought it used to be a big thing 20 years ago. I'm an immunologist. You know, we never thought about this, but now we understand inflammation. You know, and I want you to understand this. If you're in a car or if you're in a house and you have the coal pot roasting a breadfruit inside the house, not outside, but it's roasting a breadfruit, you could imagine all the smoke will fill up the room. Kamal, you can imagine that? All the smoke will fill up the room. And after a while, it's going to get dark inside and smoky and so forth. Well, imagine that stuff taking place in your body. What it does, it just sets up a whole set of inflammation. You know, toxins are just all over the place. And I'm just giving you examples of what's really happening. So, let me just say again. When blood is being pumped from your heart down through your body, down into your legs, that blood is reaching your toes, it's reaching your calves, it's reaching your ankles, it's reaching the tissues of your legs. But if diabetes has been present for a while. I'm talking about you just developed diabetes yesterday. If diabetes has been developed for a while, then a lot of the blood vessels that's supposed to take blood down into your legs are narrowed, are damaged. There's plaques inside them. And so there's not enough blood reaching down there. Boy, it can cause some problem. Let me go through some of the problem. You can start having leg pains around your feet and your ankles and even sometimes your calves. Now, other things cause foot pain. Other things would cause leg pain. But diabetes is one of the most notorious causes. If you're 19 and 20, then somebody may have tackled you badly during a football or soccer game. Or if you're a female, it might have been that the heels you're wearing might be too tight or something so. But if you're 50, 60, 70 years old and you have diabetes, it's the diabetes that's now causing you pain in your ankles. Now, if you have any bruises on your feet, be careful, because these bruises, as there's not enough nutrients, not enough blood getting to the tissues, look out. These bruises can develop into ulcers and open wounds that are not healing. And then you should know if you are having reduced blood flow to your legs. As doctors, we look for certain signs. Do you know there's hair that grows on your toes? Hair is actually growing on your toes. You see it on your big toe. When you start to lose the hair on your toes, be careful. The blood flow to your legs is becoming diminished. The hair requires some of that blood. And if your toes aren't getting the right amount of nutrient, oxygen, and so you start to lose your hair. When you lose the hair, I'm not talking about hair on your head, I'm talking about the hair on your toes. Watch out for that. And then if you also notice the nails start to grow funny, they start to get thick and looking funny and all that kind of thing, think also that there is not enough blood flowing down to your toes. Look for those two signs. But in addition, if your feet start to feel cold, now I'm not talking about those of you listening in Canada. I know it's cold up there, man. You have to have on socks and all that. I'm not talking about those who basically living in Minnesota and Seattle and upstate New York. Well, unfortunately, this is summertime, so, I could be wrong there. You could be enjoying great weather. I'm talking about people down here in the Caribbean, in St. Vincent. If your feet are feeling cold at night, it's probably because there is reduced blood flow to your legs. So pain, wounds that are not healing nicely or healing too slowly, the nails on your toes, loss of hair, and your feet feeling cold, a lower temperature, watch for that. You may be developing these problems. So why does diabetes just increase this risk of peripheral vascular disease? And let me, if the blood that's supposed to flow down into your legs is not getting there, I've pointed out you could start having a little bit of pain. You could start having wounds that ain't healing. You could lose the hair on top of the back of, on top of your toes, and you could get reduced temperature. But if the blood flow starts to really drop, you know what happens? The muscle tissue, the toes themselves could start to become gangrenous. They could start, the tissue starts to die. And you know what all this might lead to? It might start leading to having a toe cut off, having your foot cut off, having below your knee cut off. Now, long before that, you need to do certain things. A stitch in time saves 9. You ain't more wait until all that to say I shoulda, coulda, and all that kind of thing. Now, people with diabetes are at risk of developing peripheral vascular disease. But guess what? If you have other conditions as well, let me talk with somebody. If you are overweight or you have obesity on top of diabetes, watch out. If you're physically inactive and you ain't exercising, you know exercise, what that does to help your circulation move and all that kind of thing, it's important. Number 3, smoking. You know what the smoking does? The smoking is a special form of inflammation. The smoking accelerates those plaques and the narrowing of your arteries. Number 4, high blood pressure. You know, the sister disease to diabetes is pressure. Sugar and pressure are like sisters and brothers. Sugar and pressure are like sisters and brothers. And boy, if you have both of them at the same time, diabetes and pressure will accelerate your peripheral vascular disease, your peripheral artery disease, your PAD. And then on top of that, if you have been unhealthy in your eating habits and you've been shoveling down a whole set of cholesterol and your cholesterol level in your blood is high, or your triglyceride, another form of fat, is high, watch out. If you have a family history of this, you have a family history of somebody in your family having their leg cut off, you know, having a toe cut off, you should watch out for this yourself. You may have that. And then I'm talked about inflammation. Why inflammation is big. Inflammation are so many things that are causing inflammation, especially the type of food you're eating or not eating. And then if you were a person who had high blood pressure during pregnancy as a woman, watch out too. You know, as you get a little older, watch out for peripheral vascular disease. And then kidney disease and so on, all these kind of things. So I've been talking about diabetes and peripheral artery disease, but look at all these other things too. You know? Now, a number of these risk factors, right, can be controlled. You can bring down your pressure. We can reduce some of the cholesterol. You can stop smoking. You know, we can do a lot of things that will help. Now, peripheral vascular disease is as I said, a serious issue, and I want you to understand that I've been talking about your legs. But do you know the same condition that is affecting your legs, the narrowing of the blood vessels because plaques and inflammation and nerve damage is affecting the blood vessels? These blood vessels carrying blood up to your brain, the carotids, the left and the right, they could be affected in the same way. And guess what? Your coronary arteries, the same condition that affects the arteries carrying blood down in your legs, the arteries carrying blood back to your heart, the coronary arteries, and the arteries carrying blood up to your brain. Same thing, same bag of chips. And you basically, by changing your attitude in your diet, not only will you improve your peripheral vascular disease, but you lower your risk of coronary artery disease and a heart attack. You lower your risk of carotid artery disease and strokes, you know? And these things are really important. So let me just go. We take a break. We come back and we'll get into a little bit more detail as regards this peripheral vascular disease.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, and we're back, and we want to thank People's Pharmacy and so for the sponsorship here. Now, do you know that peripheral artery disease increases your risk of diabetes, and diabetes increases your risk of peripheral artery disease? I don't know if I'm losing a few persons by this word peripheral artery disease. Once again, blood has to flow down blood vessels called arteries down into your legs. And if the amount of blood that is flowing through these arteries is blocked, reduced, for whatever reason, you are going to find yourself in a series of trouble. And I pointed out to you what this trouble was again, that you could start having pain in your feet and your calves. You could start having loss of hair on the back of your toes. You can start having nail problems. Your big toe nail and your big toe and others getting infected and tick and fungus getting inside them, all these kind of things. And you could start having wounds, bruises that turn into ulcers and wounds. I've said this a couple of times, but I'm trying to do this for emphasis. Now, the worst thing that can happen, though, is having to have part of your leg cut off, part of one leg cut off. Of course, a far worse thing is having two legs cut off. You know? You don't want that. Now, inflammation. You know, anytime there's inflammation in the body, I want you to understand there's all kind of excess protein floating about in the blood. All these things tend to promote diabetes more. Now, diabetes affects the lining around the cells, the cell walls and so. And this means that the tissue that make up your blood vessels becomes stiff. They're not flexible. That means they can't expand. Let me explain that. If you start to walk fast, do you know your blood vessels expand a little bit to allow more blood to flow through? And when you slow down, well, the blood vessels go back down to normal size. And once again, I'm saying if there is a plaque or blockage inside, then sometimes the blood vessels can't expand as much. But if your blood vessels can't expand to allow more blood to flow through, and you need to walk, suppose somebody chasing you, suppose a zombie chasing you or something, so if I could say that. I don't believe it, John. Suppose you're fearful and somebody, what's going to happen is not enough blood is going to start flowing through to get to your leg muscles to allow you to walk fast or run. Sadly, When that happens, you're going to start to feel pain. You're going to start to feel pain. When your tissues are not getting enough blood, but you are pushing the tissues still, you are going to feel pain. And on top of that, when you have diabetes, your blood platelets, this is the stuff that helps with blood clotting, right? They tend to clump together more often. In other words, diabetes has a way of promoting clotting, blood clots. And blood clots will also speed up the blockage of the blood vessels and further worsen this PAD, this peripheral artery disease. And then there's something called insulin resistance. I'm not going to go into detail, but all these things affecting. Now, about 20 to 30% of people diagnosed with peripheral artery disease also have diabetes. You can get peripheral artery disease from, I mentioned diabetes, from high blood pressure and from being obese and other things like that. But diabetes seems to be the big boy, you know? And the real number may even be higher, as some people don't initially have symptoms until it's really bad. Now, so that diabetes is notorious for raising your risk of blockage of the arteries going down into your legs or peripheral artery disease. Now, some things that make it more likely to get peripheral artery disease are really out of your control. These include your age. Your risk jumps from 20% at age 40 to 29% at age 50. Kamal, I don't know how old you are, but if you are 40 years old, your risk of peripheral artery disease is already 20%. At 50, it is 29%. At 60 and 70 years old, it's starting to get up there, even much higher. Now, your risk also depends on how long you've had the diabetes. If you had diabetes for 2 years, 5 years, 10 years, but those people have diabetes for 20 years, 25 years, 30 years, watch out for peripheral. If you have nerve damage, and also if you are of certain racial makeup, if you're Hispanic, or if you are Caribbean American, African American, Caribbean, you basically are at a higher risk of peripheral arteries than if you were white. And if you have a family history, and that's why I've emphasized this, if you know a family member had a toe cut off, had a leg cut off, you should have that information because you should be watching things a little bit more carefully. But do you have some control? Yes, for certain illnesses, you have some control. You know, you don't have control because of age. You can't control your race, but you could control these other things I'm going to mention to you. And once again, being overweight and obese, not exercising, smoking, having high blood pressure and having high cholesterol. These are some of the big boys that will, if you're 50 years old and your risk is 29%, having some of these conditions is going to be the things that start putting you to 39%, 49%, 50%, you know? And so keep your blood sugar under good control. Check your hemoglobin A1C. Quit smoking. Lower your blood pressure. Whether you have to see a doctor, take some tablets or so, or you go on something natural. Cholesterol, man. We can bring down cholesterol now, you know, these days. You know, some people it's tough to bring it down, the cholesterol. We can bring it down, you know. And it's a matter of diet and discipline and so forth, you know. You could ask your doctor if he thinks or she thinks a baby aspirin. I'm going to talk about ordinary aspirin for pain. I'm talking about a baby aspirin, 81 milligrams. They essentially, in some cases, many cases, I should say, can reduce the ability of your blood to get into the clotting phase and so forth, strokes and all that kind of stuff. And so going on aspirin may be quite helpful. So this is really important. Now, I was telling you about arteries carrying blood into your legs. Well, you know, veins bring the blood back to your heart. And, you know, I've been talking on this program largely about peripheral artery diseases of the arteries. But, you know, there's also disease of the veins, you know. Sometimes the veins are just not able to help bring the blood back to your legs. This is venous insufficiency. I noticed, strangely enough, Donald Trump just got diagnosed with venous insufficiency. So it's interesting. You if you have it, you're in good company. You understand? Now, the time we have right now is 8:40, and we open up the line, you know, and I want to see, you know, if anybody has any questions about this. I have narrowed the thing to the legs. You know, I can tell you that the reduced blood going down into your legs ultimately can lead to an amputation. It can lead to an amputation because a wound develops, an ulcer develops, and then the infection that occurs around the ulcer, bacteria, dead tissue, it becomes hard to control the ulcer. And if the wound goes deeper and deeper into the skin, if the wound starts to affect bone, boy, I tell you something, it's hard to treat these things. And the big part of it, there's not enough blood. The body would have naturally healed a bruise on the leg. Naturally would have held a bruise on the foot. If you stepped on something, a nail or a piece of wood, a splinter, the body would have naturally healed that. Once you just clean it and so forth and wash it off, it'll be healing. 19-year-old, 29-year-old, they naturally heal. But for diabetics, you know, they may not heal, and the ulcer gets worse and worse. And sometimes the doctor pulls the plug and says, we're cutting that off because we can't control the infection. You know, for many people, it's the pain in the leg. There's not enough blood getting down into the foot. The foot feels cold, ice cold, because no blood is reaching down there. The blood vessels are blocked, totally blocked, partially blocked, sufficiently blocked, not enough blood going down inside there. There are people who, when they walk, the pain increases because the muscle needs more nutrients. The muscle needs more oxygen. And the oxygen can't reach that part of the feet, of the legs, because the blood vessels are blocked and blood can't reach those tissues. So the tissues cry out. The tissues cry out for pain. And sadly, because of the pain, sometimes we have to cut off a leg, not because there's an infection, but because of the pain. And it's a serious, serious, serious matter. There are things that could be done in between to try and improve it, but sometimes there. So, peripheral artery disease is a complicated thing. And we always want a situation whereby somebody with diabetes and peripheral artery disease can get some relief, can feel comfortable. Sometimes persons are not able to sleep at night because the pain is so great. Sometimes the ulcers that are there are getting so deep. And the thing about ulcers, you never want the ulcer to reach the bone, because bone infections, ulcers that reach bone, are hard to treat, tough to treat. We now have some good antibiotics, but boy, some of these germs that are causing the infections, are just so difficult to treat because they're now resistant. And I'm not talking about penicillin. I ain't talking about ampicillin. I'm talking about some of the really good antibiotics. These germs are now resistant to even the good antibiotics. So it's a unfortunate situation that one can find themselves in. Of course, I have to say to you, a stitch in time could have saved 9. A stitch in time could have saved 9. So for those of you who do not as yet have this peripheral artery disease in a major way, you don't want to have it, and you need to put the necessary steps in place. Of course, control your blood sugar. That's what's the best thing. Control your blood sugar. The second thing is take good care of your feet. Examine your feet. We tend to take good care of our hair. I see women take care of their hair and everything like that. You take care of, the way we look, and take care of our clothes and everything. But boy, we still are consuming the quantity of sugar that is causing the blood sugar to stay high. And when blood sugar stays high, the peripheral arteries, the arteries carrying blood down into your legs, get more and more blocked, silently blocked. And a stitch in time definitely can save 9. One could do something about it. And it's important that you follow up regularly with your doctor or your clinic nurse. They'll be able to check you out and check your sugar, check your pressure, check your weight. The doctor could send you for some blood tests on a regular basis, making sure you're keeping within the limits of what you should do, and adjusting your medication accordingly so as to, whether you're on tablets or whether you're injections or whatever the case may be, at least everything is important. But peripheral artery disease is something that creeps up on you. It's a slow disease, very slow, but it's ignored so much that when it hits you, right, it really gives a lot of patients a jolt, because it starts to affect their ability to work, starts to affect many different aspects of life. As I said, lying in a bed, and even you want to have your legs hanging over the side of the bed, have it hanging down, because you feel as if blood gets into your legs better with your legs hanging down. If for any reason you put your legs up, you could even start having increased pain, and that's not a nice thing. Again, I've mentioned to you about ulcers. You want to take care of your legs. A lot of persons, they have problems with their nails, and they try and cut their nails themselves. It's good to have a foot care nurse or somebody like that who could do that for you, because they would know what to do. You don't want to damage your toes yourself and trigger problems. There are tablets that we could put you on, or the not just aspirin alone, other things to help improve the circulation, help improve the blood flow. But this program is not about that. Matter of fact, there's even surgery that we can do. We can redo the plumbing. The blood vessels taking blood down into your legs may be blocked off. And with a test that we can do, ultrasound tests, Doppler tests, all kind of tests we can do to see if the blood is flowing nicely into your legs. And we could find where the blockages are and so on. But sometimes we may have to do a rerouting, so if the main highway from Kittels is blocked going down to Camden Park, you could go down Chauncey, come over Bottom Kittels, come across by the industrial estate and come up by the triangle, and then or even go through Forestry and go up Lomans and still make it. We can do a bypass. Doctors can do a bypass. These are vascular surgeons, and put in a brand new tube, right, that could carry blood down to your feet and so. And if that ain't done, if you leave the leg with the blood vessels blocked off, the arteries blocked off, no doubt some bruise is going to occur, some ulcer is going to occur, and you're going to be in a lot of pain. So it's really important. Kamal, we haven't had any calls or so, and I do want to say that the blockage of blood vessels in your legs that can cause all these problems is the same kind of blockage that occurs in your coronary arteries. Is the same kind of blockage that will occur in your carotids carrying blood up to your brain. And so by paying attention to your peripheral arteries and doing the right thing, you may be at the same time improving your chances for coronary artery disease. You'll be reducing your risk for coronary artery disease too. You'll be reducing your risk for carotid and reducing your risk of strokes. And so, of course, the biggest, I gotta say this word, the biggest killers today is heart attacks and strokes. Those are the two biggest killers of people on the earth today in developed countries and some of the developing countries. Heart attacks, coronary artery disease, I'm saying, and strokes or carotid artery disease. They're far more deadly than the blood vessels of your legs being blocked and the problems that causes. But I want you to look at all of them as being the same type of illness. And when you treat one, you're treating all. When you try to improve one, you're really improving the others too. each particular type, somebody may have blockage of the blood vessels going up to their brain, but their heart isn't so bad and their legs isn't so bad. Someone may have peripheral vascular disease of their legs, but at the same time, they have bad coronary artery disease and they have bad carotid artery disease. And so it's a mixture. And so I don't want you to see this condition I've been telling you about, peripheral artery disease or PAD, in isolation of coronary artery disease and carotid artery disease. You should get them all checked out at the same time. And by treating one, you're treating all, right? But if you have just one of those or two of those, or all three of them, you basically are in some big issues anyway. And you need some good care. You need good advice. And the advice not only comes in controlling your diabetes, controlling your high blood pressure, controlling your cholesterol, but it also is in following up with your doctor, monitoring it very carefully, you getting involved in your own care. You getting involved in your own care such that you are reducing your risk of death. You're reducing your risk of premature surgery, corrective surgery. If it's necessary, it's necessary. And I'm looking forward to the day that the new hospital at Arnesville, the acute referral hospital, is able to do coronary artery bypass. I'm pretty sure that I might need that at some point in time in my life too. Many of us will. But some of us, we can't get it because it's not available here in this country. So I'm hoping that, I know it will be available when that hospital opens. And so come out, I'm praying the hospital opens up soon. So when I check out my heart and I have any, they tell me I need a triple bypass or quadruple bypass, as they call them, that I don't have to sell my house and go to the States or go England, or so that I could have it done here, probably a fraction of the cost. And that there is vascular surgeon, if they tell me that your legs, boy, we gotta watch your feet, and notice your feet. Don't you feel pain in your calves? Yes, doc, I feel pain in my calves and my whole foot. When I walk, the pain gets worse. And I used to have hair on my toes. Now all the hair gone, right? What does that mean, doc? By Gerald, that ain't so nice, that ain't nice at all. You see all the hair gone? Why? But you know what I'm worried about is ulcers and bruises. I got ulcer already right by my ankle. Right? You do? Boy, let me examine that. But we have to make sure that ulcer don't get deeper and worse, because you know what that might mean. Don't tell me, doc. Don't tell me, doc. It might mean that you have to cut off a toe. Yeah, it might mean you have to cut off a toe. You have to cut off the foot. A foot? Doc. You might even have to cut off below your knee. Right? Don't want to do that. And worst of all, I don't know about your other leg, but we don't want to cut off two legs at the same time. Ladies and gentlemen, I've tried being a little bit more graphic than usual this time around, but I'm trying to emphasize that these illnesses are part of a spectrum where a stitch in time can save 9. And if you're sensitized to these illnesses now, they could save you a lot of pain, suffering, and money, right? Begging your brother for money to help get surgery, or having to mortgage your house, or going to Gecko or Kingston Credit Union for money and so forth. You can reduce your risk of having to do all those things by taking some important actions now. So with that, I want to say that it's always been a pleasure, and I want to bid you a very special good evening and good night. Please take care of your legs. Take care of your diabetes. Thank you very much, Lee. Goodbye.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingston.